Thank Clarissa and group for having brought us all together, and I hope that over the next 15 minutes or 20 minutes I can be of some use to you. So let me cut to the chase straight away without delaying anymore. So is it important that we learn about the coronavirus? And the answer is yes. When I gave the first of my 5 talks, this is the 5th time I'm speaking on the coronavirus in the last 1.5 months. First time when I spoke, I said, well, maybe it's important, but a couple of 100 people have died. Let's see how it's going. Second time I said about 500 people have died, and already within a month and a half, 3,000 people have died. So if some disease is so easily able to take 3,000 lives and infect anywhere between 80,000 and 300,000 people, the answers really aren't there, but we know it's upwards of 80,000. It's important. How bad can viral diseases get? You know how many people smallpox has killed until now? 300 million people. You all see the amount of tamasha and hula hoop there is when one patient in the middle of a rhinoplasty, somebody goes into some coma or something, everybody's up in arms saying, you doctors are killing our patients. 300 million people have been killed by smallpox alone. About 100 years ago, towards the end of the First World War, a seemingly innocuous flu started in one of the little towns in Spain and then went through Europe and went through India. Peter, you can come and sit down. Unless you're planning to make a quick getaway, which is not a bad idea in my lectures actually. People either running or sleeping. So an innocuous little flu, started, and before it finished up in 1919, it had taken anywhere between 50 and 75 million lives. So that's as bad as flus can get. Why? Because flus are usually viral in origin, and viruses are so difficult to attack compared to much larger bacteria, compared to worms and bigger germs. The viruses are nothing but a small bunch of chemicals that are bundled together and saying, hey, come on, let's go and bash up these guys. So it can become very, very serious. So far, viral diseases have taken such a huge toll of human lives all over the world. Even if you look at the recent Middle East respiratory virus called MERS or the SARS. If you look at MERS, quite frightening and SARS, a large proportion of those involved died. But how many people died? SARS killed 725 people, MERS some 200 people. This fellow has already killed 3,000 people, and it doesn't look like he's stopping. When I first gave my talk about a month ago, some 6 countries outside China were involved. Now it's closer to 60. So it's growing and it's killing. So that's the first part of my talk, to tell you, yes, the coronavirus epidemic, the disease is now called COVID, C-O-V-I-D, COVID. COVID is here to stay, and it's something that all of us should be worried about. First point. Second point, who is at risk of dying from this virus? So far, of the 3,000 people who have died, almost all of them are above 50 and 60, and maximum number above 70 and 75. It's almost Malthusian or Hitlerian, no? Like negative eugenics, knock off all the old guys, knock off all the sick guys. That's what Hitler said. That's what the virus is doing. It's killing off all the old people, the infirm people, the elderly lying down in bed. So it's the elderly in our society who are most at risk. But the elderly could include even very, very prominent people, like 2 or 3 top aides of the Vatican. It looks like they've been infected by this virus too. So it could take a lot of big lives. So we have to be very, very careful. Fortunately, the youngsters and the infants seem to have been spared by this particular virus so far. The most frightening thing about any virus is its ability to mutate. You all know the word mutate means to change. These viruses are very clever guys. They are like the Transformers. They are really the Transformers. So one minute they'll be looking like a crown, next minute they'll just change. You get a drug ready to hit the crowns, and the crowns become flat. They transform. And then you've got to spend time getting another drug ready to hit them. And that's why viruses are a much more difficult lot to handle compared to bacteria. And the more they change, the more difficult it is for us to hit them. How is this virus spreading and what would its implications be? So Microsoft ran an artificial intelligence program saying if a bad virus started somewhere, how many people could it kill? And the answer was if a virus started in China, it could kill theoretically up to 65 million people in this world. So this is really something out of a horror movie, thinking, my God, maybe 2 years down the line we'll turn back and say 60 million people. Or even in my mind, even if it's 1 million people, it exposes the frailty of the human being. How frail we are against a bunch of viruses. Any of us could be dead and gone tomorrow. There's an essential evanescence of life that this underlines. Right. Now, what about the UAE? Has it come to the UAE? Unfortunately, because Dubai is a center of a lot of traffic of people who have gone to China, etc., and come back, it has come to the UAE. Has it killed many people in the UAE? We don't know, probably none, or maybe less than 5, but it's involved something like 15 to 20 people if the reports are to be accepted. What's more frightening is that it's moved to all over Europe, so it's just a question of time, unless you can't quarantine a country completely. What are its implications to you and to me? The implications are that we, as human beings, as responsible citizens, can be aware of these things and at least take some steps. I always like to say the Wuhan steps. The W means wash your hands or sanitize your hands frequently, and the washing shouldn't be that you can do in some ritual, Hindu ritual. No, you can't do that here. You have to spend at least 20 seconds. So how do you continue 20 seconds? You have two options. Like a geek, you can go on staring at your thing till it reaches 20 seconds, or like a nut job, you can sing happy birthday to you, happy birthday to you, happy birthday dear Rabia, happy birthday to you. That's 10 seconds. It's timed for 10 seconds. So if you sing the complete happy birthday twice in your head, please, because we can't have people all over the world singing happy birthday to you and running around. So in your head, 20 seconds. Point number 1. Point number 2, how do you wash your hands? It's not just, it's like giving the bacteria a massage and the virus is a massage, So what you need to do is, there are a bunch of steps to be followed. You have to wash like this first, and then interlace and wash the thumbs separately, make circular movements this way, and wash it like this, and then finish up. So there's a series of steps, 6 steps of washing, and for 20 seconds, and doing that with soap and water will almost certainly kill the viruses. Right. Many people ask me these questions. Doc, what's the meaning of incubation period? Incubation period means one of us sitting here looking perfectly normal enough to fall asleep during a boring talk like this, normal enough to go back, have lunch and come back down for a talk, could be carrying the virus with no external signs whatsoever. Now, some viruses have got a short incubation period, which means within a day or two, you get sick. So in the first day or two, whomever you talk to, or if you're in the habit of coughing into your friends' faces all the time, or sneezing into their faces all the time, if you were standing behind the door when they're handing out the etiquette classes, you can infect them for the first couple of days. But this guy, you can walk around for 14 days, as many as 14 days, and there are some horror reports saying even 27 days, even 30 days. But it seems to have a fairly long incubation period, which means any of us here could be carrying the virus and you could pass it along. That's a worry. So what do? You can't just keep everyone at arm's length and say, hey, you walk there, you walk there. But if you want to, if somebody's actually coughing a lot, etc., try to keep at least a gap of about 1 meter, about 3 feet, between your friend and you. Now it's difficult if it's your boyfriend or your husband or wife coughing into you and saying stand there and cough, but sometimes we need to do this. Well, sometimes the spouses might make use of this opportunity to keep their corresponding partner away. Coronavirus, stand there sort of thing. So why is it called the coronavirus, by the way? Because when you look at this enemy under a microscope, it's got a number of little spikes sitting outside, and these spikes look like in profile like a king's crown, and that's why it's called the corona, which means crown virus. Also, this is a zoonotic virus. What's the meaning of a zoonotic? That means you'll get it in the Dubai Zoo? Yes, you will. Because zoo means zoology, is the study of animals, right? You get it by close contact with animals. The swine flu, by contact with the swine. The bird flu, by contact with birds. And for this, we don't know, but could be either bats or snakes. It seems that bats, perhaps because they bat their wings, so they keep fluttering. The internal temperature is kind of different, and they're able to tolerate all sorts of rubbish viruses inside them without the virus harming them. But then you and I are not walking around like this unless we are in the local asylum. So if the virus gets into us, woe betide us. So wash your hands. Number 2 is use masks. Now there's a lot of contention. Do masks really help? The N95 masks, no? The kind that firefighters wear when they're diving in to save some baby or something like that. You know, the N95, that seems to work. The other one looks nice, but it doesn't seem to work very well, especially if it gets wet. Also, in a very short while, it tends to get wet either with your own saliva or somebody else's, and then it's full of gobbledygook. So in that case, you have to knock it off. But that mask works in reverse if you're actually suffering from the virus. But that's a great deal of help for you. You're suffering from the virus, I know that. And then you take the mask, hey, wait, and turn it upside down or inside out and put it. But if any of us among millions, if we find one person in that situation, it might help. 3, for H, Wuhan, H, is to have your temperature checked frequently, especially if you're passing through malls, if you're passing through airports, you get your temperature checked. And I think here, Clarissa was telling me, you guys are checking with a digital thermometer. You know, you can just do this digital thermometer check. You don't need a temperature into your mouth or into your anus or into your armpit every day. You know, that would be violation of privacy and simply wasteful. So wasteful of thermometers and armpits. So you can just get the quick skin digital thermometer done. So that's have your temperature checked. And if someone's got a high temperature, and if he's recently been to China, and if his name is Wuhan or something like that, then you might need to think of quarantine, you know. Number 4 is, the 5th point is very, very important, namely N. Never, it's Wuhan, N is very, very, very important. Never take your hands unnecessarily, especially at workplace, to your nose and your mouth, which is possibly the commonest thing that all of us do, because viruses can live outside for a fair amount of time. So if you go and put your hand on that area and the virus jumps onto your hands, and then you take it to your nose, it's like giving an invitation and then rolling out a red carpet and saying, virus, please come into my nose, sort of thing. So never touch your hands to your face, especially your nose and mouth. Commonest 2 points of entry are nose and mouth. So use a mask, wash your hands. Number 1, use a mask. H, have your temperature checked every now and then. Never take your hands to your face and nose. And these simple, and also, if you find somebody who's been to one of these areas, it used to be 1 and 2, now it's 60 plus countries. Soon it will be anybody who's traveled abroad, you have to quarantine them if they have temperature. Next point is, what kind of presenting symptoms? Almost all these guys have a cough. Okay, cough is the number 1. Number 2, how does it kill you? Don't look at him. Everybody who has a cough isn't having the coronavirus. You know, you wish. So, if somebody's been to one of these areas and they have a cough, and then they're having a bit of temperature, then they need to be quarantined. So, how will you check these guys? Now the test kits are available. They're available here at Rajkumar Hospital and at the Dubai Hospital. If you suspect somebody, please send them off, quarantine them, send them off to the Rajkumar Hospital or to Dubai Hospital so that they can have the test kit done. And even if they test positive, they're not going to walk around like zombies in the Return of the Walking Dead. They're not going to do that. They're just going to be quarantined. They're going to have the same food, watch the same boring television programs, listen to the same boring lectures for a few more days till they run out of their temperatures, and they'll be back home. Because this virus only kills 1 to 2% of the people. Because it's involved more than 100,000 and 150,000 people, 2% comes to 3,000 people. So this virus is not a very lethal virus, though it can kill. 2%, it's not low, it's not very, very high. If you look at the SARS virus or the MERS virus, which came from camels, they killed nearly 5 to 7%, whereas this is killing about 2 to 3%. So it's not the end of the world, but in brackets I would say, but you never know, and I'll close it off. So you can't quite tell, but let's all be prepared for it. What drugs? People keep asking me, today it came out somewhere, India's got a vaccine for it, we got a vaccine for it, we got a vaccine, they've started testing, and they said not for this outbreak, but after 2022, if there's an outbreak on humans, then this vaccine, if tested in the next 2 years, might be helpful. And this is the article that's being sent from one WhatsApp to another. Yay, India's got a vaccine, India's got a vaccine. India started trials on a vaccine that may work if it attacks humans after 2022. So in brackets, it says, if there are humans after 2022. So yes, there is a ray of hope. While I'm joking, there is a ray of hope. But hopefully we will have a vaccine. There are a lot of people working on vaccines. What about drugs? Is there a special drug for it? We know that some of these nucleic acids behave like the AIDS virus, like HIV virus. So the same drugs that act on HIV virus, we're also using them on these viruses, and it seems to be a little effective. There are also some reports saying that chloroquine, which is anti-malarial, may work on this. Everything else, garlic, potato, fried rice, my mother's rasam, somebody's sambar vadai, we have some curry, it won't come to us. We are hot in India, it won't come to us. It's just bull. It's just, there's no data to say that there's a particular type of your grandmother's fried rice will help you and your grandmother, but it won't help you against this virus. With due respect to all grannies out there, who, if you ask me, a granny instead of making fried rice should be careful, because this virus is out to get grannies and granddads. So I would protect grannies and granddads. Avoid, in the Wuhan, I forgot to tell you, the fourth one is avoid crowded places like malls and airports. Now why? Many people say, doctor, why are you getting scared? I said, no. How do you know that one of us isn't carrying the virus? Yeah, maybe they are, but we simply have to work. You can't suspend all work everywhere. Now, you're multiplying this probability 100 times if you go to a place where there are 20,000 people. You don't know about any of the 20,000 people. So don't increase the probability of getting the virus. So that's why you should avoid malls and avoid crowded places. And last but not least, the WHO is setting up regional centers, including in the UAE, because now it's officially in the UAE, it's in Arabia. I know that the newspapers said yesterday, the headlines, that WHO said that regionally, this region is not very well prepared. Yeah, because there are guys fighting in Yemen and Syria, and they have bullets to worry about rather than viruses. So hopefully the WHO will help the regional centers fight the virus. Most importantly, check for virus and isolate people for the virus, and a lot of good work is coming from the WHO. What I find most difficult, of course, is to pronounce the name of the WHO Secretary General. It's some Abedos or something like that. But they're doing a great job, and regionally they're doing a great job, and hopefully we should be able to at least quarantine or contain the virus. Another frequently asked question is, how long do you think all this is going to last? How long is a piece of string? You never can tell. But if you go by previous viral attacks, anything between 6 months and 1 year was what it took for SARS, for MERS. The Spanish influenza attack was a massive attack, came after the Second World War. All the people were very weak. There were no antibiotics, so it ran around for 1.5 years. I hope and pray that this one will be over and done in 6 months to 9 months. I know that the 6 months to 9 months has a huge economic implication for the whole world, not just for this region. But all we can do sometimes is to understand, as I began, that we are essentially a frail being with a limited shelf life on the planet, and think of the larger picture beyond political differences, beyond geological and ethnic differences, and hope the best for the world.
They're not safe for children, you were said in the newspapers or whatever. Yeah. Is there a certain age below which it becomes, or above a certain age which becomes safe for children to wear those N95 masks?
It's a very good question. Above 12. It's fairly safe. Small children, they can tend to get suffocated. They don't know how to breathe well. then the carbon dioxide accumulates. So a few cases of carbon dioxide buildup were reported by the N95. So it's a difficult toss-up. Do you want to protect yourself against the virus, or in the process do you want to hurt yourself more? So adults, very safe. Above 12, very big kids, it's not a problem. And you should also teach them to take it off now and then and take a few breaths of fresh air.
Patients with coronavirus managed or treated? There's no like direct treat for the virus itself.
There's no direct treatment.
And how long does it last for once you know that
the median time, see, because this is the first part, there's lots of paranoia. Median time of in-hospital stay in the patient so far is 12 days. And they're treated with antibiotics because viruses, these guys will weaken your lungs up and allow neighboring bacteria to finish you. So you have to give antibacterials, powerful antibiotics through the blood and counter it, give them ventilation, help the lungs along. So that's how we would treat them, and primarily to quarantine them.
For example, someone has been detected with a viral flu. How soon should she go back and get it checked again?
Brilliant question. Very nice question. I mean, you have kids. You guys have kids. Your kid's got a fever. I've had at least 30, 40 calls saying so-and-so's kid's got fever. Do you think it's coronavirus? So the answer is just a flu, and the child hasn't been to China or Japan or South Korea or Italy. You don't have to do anything. Just treat it like a normal flu. Just a flu. The child is in contact with somebody who's been to China or Japan within the last 14 days. Then you take the child and the guy who's been to China to Rashid Hospital and get them to have the coronavirus PCR test done. The PCR is that polymerase chain reaction test. You need to have a PCR done. Somebody with fever, with breathlessness and cough, irrespective of whether they've traveled to China or not, in this period you have to think about it as due to coronavirus unless otherwise proved. So that's how you stratify patients, and you ask them, have they been out? No, they haven't. Have they been in contact with somebody who's out? No. Father hasn't been out, etc. 3, is the child breathless, etc., etc.? No. If the question is if the answer is no to all these, then the child doesn't require to be tested.
How much is the test kit? Is it covered by the insurance?
The test kit is not available, only now it's going to be made available in private places. You have to send them to the government hospital, and it's completely free if you suspect that.
A question. We've heard about how it's affected the travel industry. Right? What are your views on traveling abroad? Now, I know we are within this country, so going back to the home country, is that something that you would recommend we defer, or do we go about? I mean, how do we approach this?
It's a good question, and you need to be, if your home country is in Hubei province, then I would say don't go back to your home country now. But otherwise, if your home country is India, for example, or Pakistan, there's just so few cases reported, 3 or 5 in a population of 1.3 billion. It doesn't even count. You know what I mean? So you can travel. The problem is that en route you have to go through the Dubai airport, in which there is a lot of traffic, and there is a small element of risk. These risks haven't been quantified because this disease is so new. It's only 2-month-old disease, COVID. So
does Rashid Hospital require like a referral from outside doctor, or they can accept walk-in that just wants to have like this test?
You can walk in if you had temperature documented, if you have a chest X-ray that shows something, or if you had contact with somebody who's been to China, or you were out there practicing Kung Fu, something like that, you know what I mean? If you're part of these, if there's a definite link of the disease process, of the chain of transmission into your system, then they'll take you.
Also, probably many people who don't want to go to clinics and hospitals because they think that that's a center for where obviously the disease could exist, the virus could exist, right? So what would be your advice, like in terms of, should you avoid these kind of establishments? Or
that's probably the best question that was asked today, because he's absolutely right. Intelligence has multiple dimensions and multiple layers. If you read the newer definition of intelligence by Cambridge. So this is a greater layer, deeper layer, saying, well, I'm going and checking. You may go and you may actually check negative, and you may come back with a coronavirus sticking to your shirt. You know what I mean? So I would, unless absolutely warranted. In other words, as a surgeon, you're thinking, do I go inside, operate and pull out this guy's colon? Or do you think I'm going to lose him on the table? Not for coronavirus, for a colonic cancer or something. And there are risks that your patient might die in the process of you wanting to do good for them. You have to constantly do a risk-benefit analysis and say, well, overall, I think I'll whack it out. Or I think I'll back off and allow the colon cancer to get him. Similarly, unless it's absolutely warranted, I would go by what he said and keep off places where everybody's walking around sick, because you're much more likely to contract the virus in a public place like that. Much more. So you go there when there's a lot of data to show that you may actually be having the virus, and in the interest of your lungs, you want support, and in the interest of the people around you, of the spread of coronavirus itself, better to quarantine yourself. But we are such a humans are such a selfish race, aren't we? There are just a few moments in a day when we think of others. You just think about it. I, me, mine. 99% of the time it's me or it's mine, or my kid, or my husband, or whatever. And you need to have the guts to say, I think I'm having this, let me go to the hospital, let me give myself up for quarantine. And I really admire the Chinese who in 10 days built those 700 bedded hospital. They've done so much for themselves.